How do liquid biopsies detect bladder cancer recurrence? Imagine a simple blood test or urine sample that can tell if bladder cancer has come back without needing a painful or invasive procedure. That's what liquid biopsies aim to do. They analyze tiny pieces of tumor material that are shed into bodily fluids by cancer cells. In bladder cancer, especially transitional cell carcinoma, these tumor fragments include circulating tumor DNA and circulating tumor cells. Because bladder cancer often affects the lining of the bladder, tumor cells and DNA are released into the urine, making urine a rich source for testing. Blood samples can also contain tumor DNA from cancer cells that have entered the bloodstream. The key to how these tests work is detecting specific genetic mutations associated with bladder cancer. For example, mutations in the TERT promoter, FGFR3 gene, or DNA repair genes are common in bladder tumors. When these mutations are found in urine or blood samples, it suggests that cancer cells are still present or have recurred. The presence of tumor-specific DNA fragments in urine is especially useful because it is in direct contact with the bladder lining, making it highly sensitive for detecting local recurrence. Unlike traditional tissue biopsies, which sample only one part of the tumor, liquid biopsies can pick up DNA from multiple tumor sites. This helps provide a more complete picture of the cancer's genetic makeup and whether it is progressing or returning. Because the tests are minimally invasive, they can be done repeatedly over time, allowing doctors to monitor patients closely after treatment. This ongoing surveillance is vital in bladder cancer because it has a high chance of recurrence, even after initial successful treatment. While cystoscopy remains the main method for checking bladder cancer recurrence, liquid biopsies can add valuable molecular information. They might detect signs of recurrence earlier than cystoscopy or imaging, especially in high-risk cases. These tests can also help guide personalized treatment by revealing specific genetic changes that might respond better to targeted therapies. However, it's important to remember that liquid biopsies are still being studied and validated. Some tests may have limited sensitivity, especially for low-grade tumors, and false positives can occur. Multi-marker panels that look for several genetic targets at once tend to be more accurate, but they can also be more costly. Large clinical trials are ongoing to determine how best to incorporate liquid biopsies into routine bladder cancer care. In summary, liquid biopsies detect bladder cancer recurrence by analyzing tumor DNA and cells shed into urine or blood. They offer a non-invasive, repeatable way to monitor disease status, providing molecular insights that complement traditional methods. While they show great promise, they are currently used alongside cystoscopy and imaging, with ongoing research to improve their accuracy and clinical usefulness. Always consult with healthcare professionals to understand the best approach for individual cases.